Recording. Good late morning, everyone. I'm Tara Chetok, and I am the project manager for the Oregon Health Policy Board. Thank you for joining us today for an educational webinar on REALD and SOGI data. We appreciate everyone being here. When I'm not a project manager on the board, I'm also a project manager for a work group of the board called the Committee Membership Work Group. And this work group was formed about a year ago when the board asked us to look into the recruitment and retention and diversity of members of the Oregon Health Policy Board committees. And so this work group has been working with consultant Ignatius Bow the past year to improve the processes and look into how we build more diverse membership among the board and its committee's members. And so today we wanted to have an educational webinar on REALD because we are going to be asking all of our board members and committee members to complete a new member survey that asks REALD and SOGI questions, as well as questions about health equity, expertise and experience, as well as cross-cultural experience. And so we wanted to provide some information to members and staff and the public and community about why it is so important that we are asking REALD questions and what do we do with REALD data, and then also providing some key messaging that you all can take back to your work when deploying REALD and SOGI questions. Just so you know, today's webinar will be recorded and we will share a link with all attendees after the webinar, and the recording will also be placed on the Oregon Health Policy Board's website. And without further ado, I'd like to welcome Dr. Marty McGee and Dr. Kwaku Wilson, who will present to us this morning on REALD and SOGI data. Go ahead and take it away, you two.
Hello, good morning, everyone. Pleasure to be here with you all. I'm Marjorie McGee, the director of the REALD and SOGI unit in the OHA Equity and Inclusion Division. Kwaku, would you like to introduce yourself?
Good morning, I'm Kwaku Wilson. I'm the REALD and SOGI Data Analytics Manager in the Equity and Inclusion Division. Thank you for your time today and look forward to our interaction.
Thank you. And I just want to confirm you can see the first slide, everyone?
Yes.
Great. Great. So, today is about REALD and SOGI, race, ethnicity, language, and disability, and sexual orientation and gender identity. Updates and what does it mean for us? The objectives was to start off with about the importance of REALD in terms of our 2030 goal and health equity, provides a little bit of background, summary, talk a little bit about activities to date and or planned, work group recommendations, and then focus hopefully more on what were responses to the work group recommendations, how do we use REALD, and common questions and concerns. And if time permits, if we have time, we'll talk a little bit more about House Bill 3159. I will keep an eye on the chat and we'll get started here. So, as I think most of you know, we have a goal to eliminate health inequities by 2030. This is a very important goal. The OHA core value of health equity consider the diversity of Oregon communities as we make decisions about how policy and practices are developed and how resources are distributed. And what's really important in this is we need to make sure that who's at the table making those decisions is diverse in terms of their lived experience and their expertise. REALD and SOGI data can help us meet this goal. This is a new a revised framework of the social determinants of health that was put forth in last year by Kirby. And I like it a bit. And so I thought I would share that with you. But on the left side, in the root cause of health inequities, talking about the structural determination, structural elements. So racism, sexism, ableism, classism, language. Those are our structural determinants. Then the idea is that we have tools that either make it harder or easier to reduce the structural systems of oppression. The laws, the political processes, statutes, budgetary decision, do we allocate enough money to do the work? Regulations, do we enforce? And then all of that has an impact on the system, including public health and healthcare, education, so on to health and well-being. And REALD and SOGI, the rules and the laws, they are a tool to help us unpack the structural determinants, which is why I really wanted to emphasize in this slide. And the other piece about REALD and SOGI, we'll talk more about what it is in a minute, but what gets measured gets counted. And we cannot adequately assess how racism, disableism, lack of language access impact community and individual health. Going back to this slide, we're not so much collecting race, but we're collecting information about exposure to racism. And that's where we want to get to here. The other thing we know since 2009 from the Institute of Medicine report is that we've reached the limit of how we can use the federal OMB race ethnicity standards to discern, to identify and address inequities. We've reached our limitations. The lack of granularity in race ethnicity masks important inequities in health and healthcare. And the Institute of Medicine report was recommending that we have more granularity, local standards having more granularity that meets their needs. And that's what REALD does. It's the race, ethnicity, language, and disability. Indeed, REALD is a tool to help identify and eliminate systemic health inequities. So very briefly, what are the laws around REALD? Well, the first one was in House Bill 2134 in 2013. Basically said to OHA and ODHS, please develop the data standards for REALD. The challenge we've had is many of our data sets are not in our direct control. So we have data that we receive, like the birth records, death records, marijuana registry, the cancer registry. Many of these come from providers. We don't have direct control. We can make our data systems REALD compliant, but we're still getting the data in different formats. So when the pandemic hit in 2020, realizing that the data that we received for COVID was not sufficient. And so House Bill 4212 was passed in 2020, and it required REALD collection for COVID encounters by the ordering provider. And so that meant that we had to go back and update the 2134 rules, data standards, so that we were not asking providers to do that later. So we do it all at once. And then just recently, this year, House Bill 3159 passed. And this added SOGI, we call it sexual orientation and gender identity. It requires us to update our rules to include SOGI. It also requires us to create a registry, a centralized registry where we get all the data for REALD and SOGI from providers and insurers. And if we have time, I will say more about the 3159 registry. But let's move on. So what is the REALD data? Race, ethnicity, the 3 questions. I think, Quaker, would you mind putting a chat to the template in the chat box, please? We'll put a chat to the template so you can see for yourselves for the service space. There are 3 questions. Here's an open text question, a multi-select with 39 categories, and a primary race. When we were working on House Bill 4212 and updating the rules, we found that there were about 5 groups that were impacted by COVID, but that were not on our list of groups. And so we added them because they were highly impacted. So Somali, Ethiopian, Marshallese, communities of Myanmar, for example. We also revised the language questions so that they would work better. We found from the data that some of the questions were confusing as is, so we cleaned that up. And we added a question about languages used at home to work as a triage question. So we could put in skip patterns. So if they said English only, then we could skip the rest of the questions. And then we also added 3 disability questions. So we have 9 total. And we added the 3 because we found that there was portions of people with disabilities who were not being captured by the other 6 questions that is used by the census. So why do we do this? We do this to ensure access and equity in services, processes, and outcomes. We provide consistency in data collection. At the end of the day, together with this data, we can identify inequity, determine which groups are most impacted, like we did with COVID, use the information to improve services and reduce inequities, address these inequities through policy and legislative efforts, we allocate resources and funds needed to effectively address these inequities, and design culturally appropriate and accessible interventions. I'll say a little bit more here, and Quaker, please add to this. One of the things that was very helpful in House Bill 3159 is that we received significantly more funding for staffing. So it's going from a 1-person team, myself, to a large team in OEI. And Quaker, Dr. Wilson is the data analytic manager. We'll be hiring a program manager. But for the first time, we'll be able to provide in-depth facilitated technical assistance, training, develop resources to help facilitate implementation of REALD and SOGI, and at different levels. So not just internally in OHA, but with providers, and also to work with the communities who are most impacted by health inequities. We have a few activities coming up in the next year. One is we will have to do a rulemaking advisory committee for the SOGI data standards in February and March. Be about 4-month process, so we're finishing this summer, I hope. But that's a very careful process where we engage people and we work together and figure out what are the SOGI's data standards. And we're spending the next year on planning for the registry, figure out the specifications for this registry, how it will work, what we, how is it going to interface best with providers. We've been exploring the FIRE app, Fast Healthcare Interoperability Resource, as an option to make it easier to align national standards with their local standards. We will also be working very closely with the communities most impacted to find out their concerns about the registry or what they need in the registry to make it work, as well as providers and insurers. Craig, can you add a little bit more also about the internship and survey app?
Sure, thank you. So we, in addition to what Marjorie said, we are looking at establishing and understanding workflows from the provider perspective. And we are at the stages of developing an internship with the Oregon State University, where students would be will be kind of paired up with specific pilot providers to collect this data and help us to understand the workflows. And all of these are designed to help share this information in ways that we can scale this work and reduce the current problems that we identify. And so that is one specific initiative that we're working on, and we're expecting that by the beginning of next year, we would have some of these interns deployed specific to areas where we think would be priorities, such as where we have communities that we can learn a lot more about this work from their perspective. The community we are targeting at this stage is in Woodburn, and we can share some details later on.
Thank you for that. We'll go ahead and focus now our conversations to the recommendations that came out of the work group, the membership committee work group. So there are many recommendations. I just wanted to highlight two that were relevant to REALD and SOGI. And that is that all Oregon Health Policy Board committees should engage diverse, underrepresented, and excluded communities, and to support recruitment and retention of more diverse committee members. And REALD and SOGI data grant collecting REALD data was also another recommendation that was listed. It's important. One of the other statements that was made in the recommendations was, and I'll read it out loud: there is a need for committee members with subject matter expertise about diversity based on self-reported racial and ethnic identity or other identity and cross-cultural experience based on living among, working with, or learning about communities and populations different from one's racial or ethnic identity or other identity. So basically, the lived experience is very important. And it's important to be more intentional about making sure that who's sitting at the big table has good representation. It goes back to this slide here on the structural determinants of racism and the power, thinking about power, sharing power. we need to diversify the work groups. So there was some work to collect REALD in 2 committees that I think one of them was the Health Equity Committee. And we've learned some things. One, and in the process of including REALD questions on the nomination forms, the report mentioned that there were some double standards. The tendency is to have double standards. So feeling like it's okay for us to collect this. This makes sense to collect it from patients, but why should we collect it for members? Or that again, it's good to collect it from patients, but for us, do we really need to ask this? So there are some double standards. And that's important to pay attention to, is to keep interrogating our own reactions as we do this work and to unpack that. The survey results were generally positive. There was a concern that a lot of people might not like REALD or the questions, but that did not come out in the survey. There were some concerns, however, that came outside of the survey, mostly from a couple of people with disabilities. And since then, I've spent a number of hours and communications and conversations, and I'm trying to make the distinction between we're asking about disability as an identity versus asking disability to identify a population of people who might be exposed to disableism. It's different. Not everyone identifies as disabled, but they may be exposed to disableism because of lack of access. There are many people who don't say that they have a disability. So it's very difficult to use identity questions. So we will address this in the next rulemaking advisory committee. There's no reason to add a question about identities after the questions. The other challenge that we learned is we cannot assure confidentiality due to the Public Records Act, that when people share the information that we can keep it private. We are hoping to fix this in the next short legislative session to put in some language that would allow us to keep that private. There were some commonly asked questions and statements which I've already alluded to. I'll go ahead and actually, Tara, oh, go ahead, you have your hand up.
Thanks, Marjorie. I did receive a question through the chat, so I wanted to read that out loud for an answer. The question reads, is there an alternative form for people to fill out the REALD survey who are colorblind or who have cognitive overload issues?
No, but we can do the survey in person or verbally in an interview format. We have a phone script that we use for people who do REALD over the phone in English and Spanish. If someone was colorblind, I would be very much interested to see how we can change our survey format to make it more accessible. But if it's cognitive overload, it may be that we need to do that in a verbal format. But if people have those specific, if they know exactly how we should modify the format, please reach out to me. Tara, can you put my email in the chat?
Yeah.
And let me know exactly how we should modify the templates. It's very important. Thank you. And so Tara, I was wondering if I could ask you for your help in reading the questions, and then I'll respond. We can just do one at a time. I'm
Yes.
putting you on the spot.
I love it. Thank you. And I think just for everyone's reference, as the committee membership work group is launching the new member survey, which is asking the Oregon Health Policy Board members and its committee members to complete this new survey that includes REALD and SOGI questions. We did undergo some baseline testing like Marjorie alluded to, but we also, through baseline, we started to hear some feedback. And so here on this screen, are some of the commonly cited statements and questions that we heard. So we'll go through these, and certainly if other people have heard questions or statements that aren't represented here that you would like us to address during today's educational webinar, we're happy to do that, because we really want to provide you all with the information and messaging on how to support the participation of REALD. So first question we have that someone may ask when completing the REALD template: why do I need to answer questions that don't relate to my role as a committee or board member?
My response to that, I think about that all the time. For example, I identify as deaf and hard of hearing from birth. But my job as REALD and SOGI director doesn't mean that I focus on accessibility for deaf and hard of hearing people, right? I focus on REALD and SOGI, but not on accessibility. But because of my lived experience and my professional experience, whenever I'm thinking about REALD and SOGI, that comes in, that lived experience and the professional experience, but that lived experience comes into my way of thinking about REALD and SOGI. It is related. So the lived experience, even though it might not directly, it may not say in our position description that we have to know about the community that we come from. It does come in. It comes into our work. It just may be, we may not be aware of it, but it does come in. So answering the questions is very helpful from that perspective. And also it helps us to see who do we have at the table here? Who's involved in making the decisions? You know, what's there? If we don't answer the question, we won't know. Yeah.
That was great. Thank you. Thank you, Marjorie. Second question. It's kind of more of a statement, this one actually. So we hear this a lot. REALD questions are too personal and I don't feel comfortable answering them. How do we respond to that?
Well, if you don't feel comfortable, you can always say, I don't want to say. You can decline. That's fine. But we need to ask. We need to normalize the asking of REALD and SOGI questions. We need to reduce the stigma around some of these questions. It's interesting. Again, I go back to thinking about disability. People tell me, you know, the disability questions are intrusive. But for people with disabilities like myself, we want to be counted. We want to be seen. We want to be what, going back to my statement earlier, what gets measured gets counted. We want to get counted. We want to be seen as a health disparity population. We experience inequities. And so I'm happy to answer disability questions. But it may be that the internalized stigma and externalized stigma around disability, good intention of not wanting to ask because it might be seen insensitive or intrusive, but it has a bad impact because we can't count, we can't see what's happening in terms of inequities. So that would be my answer. But that said, everyone has the option to say, I don't want to answer this question. It relates to the third bullet, where it says, I don't want to answer the REALD questions, it takes too long. You can decline. If you're in a hurry and that day is not the best day, just decline each one.
Right. Well, you're moving right along the list here. And so this also then kind of plays into the fourth question here. So on the same kind of topic, so why does it matter if I answer the REALD questions if I'm just going to mark decline to every answer on every question?
Because we need to know that you were asked. If you don't fill it out, we don't know that you were asked. Some information, having information about decline is better than having no information at all. And it's interesting because what we found in the one data, Oregon Health Plan data, is when we started making it required with the option to decline, very few people declined. And it increased our data quality so much more. It's been much better since we require it. But if you let things be skippable or people don't have to answer, they won't answer. We won't be able to get that information. So, asking people to answer the questions with the option to decline is a middle ground.
Great, thank you. Moving along, next question. What are you planning to do with the data, and will my individual privacy be protected? And this, we also received a chat question too that speaks to this. So we can go ahead and let's go ahead and answer this, and then I have a follow-up question to also add.
And I think the individual privacy, we're going to be looking at it bit. Right now, going forward, we need to be clear with applicants that some of the information we cannot guarantee confidentiality at the individual level. Generally, what we try to do is report at a summary aggregate level, so that if you have a committee of 5 people, for example, or 10 people, or whatever the size is, you think about how easy it is for anyone outside to know who's who based on REALD, right? To know, oh, you're the person who uses the real share, who's this and that. And so there are ways that we deal with that in research. When we report out so that people cannot directly identify the individual. That is how REALD and SOGI data should be done for applicants as well. That's public information. But we've learned that we cannot, there's no guarantee that if there was a Public Records Act request, that we can suppress the individual level data at the detail level. So we'll fix that in the next session. In terms of what are you planning to do with the data, Tara, can I pass that to you for the committee?
Yeah, so in regards to the REALD and SOGI questions that are going to be completed by the board and committee members. We are going to be collecting that information via an online software program called Qualtrics. And we'll also make a paper copy available for people to fill out by hand if they prefer. And so we will be storing that data, and only a select few folks from our project team will have access to. And what we'll be doing is summarizing the data results and providing a baseline update to the Oregon Health Policy Board at its February retreat. This was a request from the Oregon Health Policy Board to the Oregon Health Authority staff about a year ago when they had requested to see REALD data for all of its members. So that's to honor that request. And then beyond just REALD and SOGI, in our survey, we're also asking open-ended health equity questions about someone's lived experience with health equity, as well as their cross-cultural lived experience. And we really want to highlight the different strengths, skill sets, the whole person that is represented in our community, in our committee, so that we have a better representation of all of those that serve on the board and its committees, which we have about 200 members now. So this is to fulfill that request. And then also to continue to explore how do we improve our recruitment and retention efforts to have representation from all communities seen in our board and committee memberships. So that is what our work is focused on there. I see that there was a question, kind of a follow-up question that I was alluding to. And Marjorie, someone is asking if other committees outside of the board or other groups are collecting REALD data from their membership. They're wondering if they keep it or they send it to your group. And
yeah, so no, generally OEI does not see the REALD and SOGI data unless we're working, collaborating with the program on a specific project. Our role in REALD and SOGI unit is to get us started to implement REALD and SOGI, but and to capacitate our programs inside OHA and ODHS to do it well. There are some data sets that I look at specifically, but not committee data sets, more in the one system and COVID data. Those are the two. And when I do that, I'm looking at data quality, not at the person. I'm looking at how well is this data working? How well is REALD working to capture with the rate of missingness, declines, you know, how are we doing? So that's our lens when we look at the data.
I received a couple other chat questions, but I see Jeanette Taylor, who's actually on the committee membership project with me, has her hand raised. So Jeanette, I'm thinking maybe you have something valuable to chime in and share.
Yeah, I just wanted, thanks, Tara, and thanks, Marjorie, for your great presentation. I just, to that earlier question, I just also wanted to give a little context. So the work that we're doing in the committee membership, you know, I think this is hopefully spearheading the effort to be collecting you know, both the demographic information as well as lived cross-cultural experience, you know, your health equity experience. So sort of spearheading that effort in our committees and other advisory bodies or decision-making bodies to the OHA. And I know we've received a request from one group already as to whether that group can use the survey that we're about to launch for existing committee, OHPB committee members. And we're not there yet to be able to hand that off, but I think that's an active discussion. And so, and I think there's a higher level conversation happening amongst leadership and various points of contact in your division. So I would encourage folks to, and I think, Tara, we have the names of those individuals, so maybe we can share that out afterwards, because that's something we even in our work group are trying to, oh no, I think I'm conflating that actually with another effort, compensation, and sorry, there's too much stuff. So, so all that to say, we're still trying to flesh out our processes for what are we doing with the data, especially because we can't promise confidentiality. I mean, we're really kind of in new territory here and wanting to be extremely cautious about, not screwing this up, quite frankly. So I just wanted to put that out there. And if folks have questions, you can, I think, feel free to reach out to me and Tara, if you, to reach out to us and we can help give you some feedback and perhaps resources as we get further along. But I think just know that we're not at a fully coordinated standpoint at the agency level yet.
And I would thank you, Jeanette. And I would just add that also keep us, the REALD and SOG unit, close on those conversations. The other thing I just wanted to clarify around the individual privacy and confidentiality, that seems the only gap in that which shows up seems to be with our board members, commission members, WAC members, rulemaking advisory committee members. That's the only gap we are finding is protected with the data that's sent to the Oregon Health Plan, the data we get from providers. None of that is protected, but this is the one gap where we're going to have to do some like statutory or rulemaking to fix that gap. And I did receive assurance that this will be a priority in the next short session. So this is a temporary problem, I hope.
And
so
sorry,
maybe this year we can't, but maybe next year we can.
Yeah, and I just want to put one more facet to this, which I think we're a little bit less clear because we're actively consulting with DOJ, but there's also, the waiver project team is another group that, is in the middle of some very public and a pretty broad community and partner engagement to get feedback to inform, the waiver application that will go in February. And so that process is also asking for REALD and SOG, I believe SOG data. And it's just such new territory that it's a little less clear whether folks submitting public comment and if they submit their REALD information, if, to the degree that we can promise confidentiality. I think it's a little bit different when someone's applying to be a member on a public advisory or decision-making body. But so just know that these are questions and conversations we're having with DOJ. That's just another facet to, as we, spread the collection of REALD and SOG, which is great. But we're also tackling these implementation, issues as well.
Thanks, Jeanette. I think it sounds like, Marjorie, we may be on the hook for future educational webinars to provide updates as this information evolves and new rules are available. So thank you, Jeanette, for adding that additional information. And I want to be mindful of time. I see that I have a couple more questions that popped up into the chat from folks, Marjorie. So I'm going to go ahead and read those and let's answer those. And one of the questions is, when someone asks how we define serious difficulty, is there some standard we are using? Personally, I'd focus on how it interferes with function across multiple domains / contexts of living, but leave it ultimately up to them. So I believe this is referring to some of the options within the REALD template when someone could select the option of serious difficulty.
That's a great question. So these you'll notice that this serious difficulty is not on all the disability questions. It's only on some of them. And that was because there was this, it's extraordinary, amazing cognitive evaluation that was done at a national level. And they tested, if we add the word serious difficulty, if you don't add the word serious difficulty, then you would have a lot of people say, yeah, I have difficulty. But when you add the word serious difficulty, you get to the people who really would most likely experience disablism or access issues. So some of these questions have the word serious difficulty because they've been tested to see that it does nail who would say yes. Some of them don't, because when you do add that, very few people would say yes. So every single question, every word has been tested in all of those questions. So the other piece is they're intentionally subjective. And so there's no right way to answer to say what is serious. So it's going to be up to the person to decide that for themselves, what is a serious difficulty. But the nice thing is that we know with the evaluation that was done, the data is good. That it gets us what we need to know in terms of prevalence of people with disabilities at a population level.
Thank you, Marjorie. Person who asked also said, interesting, exclamation mark. So they appreciate that response. Another chat question I received, and I don't know, this one seems tricky to me. I hope we can answer it, Marjorie. The question reads, are there any protections for people to use if there are any repercussions for their disclosure? For example, someone gets taken off a project after disclosing their disability, especially for invisible disabilities. So I'm not sure we've had that experience come up, but how would we handle that if someone felt like they were removed from a committee or a work group after disclosing their answers to the REALD questions? Perhaps we'd have to ask DOJ.
I mean, in the same way, I mean, this comes up in the workplace, it comes up in other places, right? So always wondering, did something happen just now because I disclosed, whether it's on the basis of disability or sexual orientation, gender identity, race. If I see that Leanne's on the call, maybe Leanne, would you chime in, please?
I sure will. Thank you. Thank you. That is a great question. And there is, pardon me, I'm Leanne Johnson, she, her, hers, Director of the Equity and Inclusion Division for the Oregon Health Authority. And we do manage out of our division, the Equity and Inclusion Division, the non-discrimination for the public. There is statute that prevents discrimination of the public. And so this, what you have described would be a potential violation of that. And so there are forms on our website that people can fill out to file a complaint, and then we would work to either resolve and reconcile the situation or do an investigation. So there are protections. It's basically under civil rights federal statute that those protections exist.
Thank you.
Thank you.
Yes, thank you, Leanne. That was helpful. I think I found the website here, so let me share that link with everyone. All right. If I'm tracking correctly, I think I am. Those were all the chat questions that I have received, Marjorie. I believe the last question, we kind of partially addressed this earlier, but if you just want to refresh people's memories, if someone asks for REALD questions in a different format or language, is that available?
The different languages, yes. We have 20 some languages. I put a link earlier to those different languages, about 20 some languages, 21. If you need another language that's not inclusive of those, and if you find there's a high need, let me know. Otherwise, the best use an interpreter and ask the questions verbally and in other formats. We have phone scripts on our website to help people do this over the phone or in Zoom, Teams, in an interview format. And that's another good format, a way to do it. Some people, they're doing this on paper is not easy to do at all. It's going to be better to do this in person. If there are things, a different kind of format that you suggest, please let me know. Please let us know, Quaku and I.
Great. Thank you, Marjorie. I just want to make sure we do also create space in case any other questions came up from folks on today's webinar. You can always feel free to send your question to me in a chat and I can read that out loud, or if you prefer, you can raise your hand, unmute yourself. Also welcome any comments or reactions. So as we give a moment to see if there's any other questions, Marjorie, we have about 6 minutes left. And I know you had some more slides, but I don't know if that's going to be enough to get through. So certainly if there's anything.
Yeah, actually I would like to say, I think I would like not to go through the other slides. We can include it in the slide deck so that people can see it if they want to see it online. But we'll be updating our REALD website. We're creating a few more web pages to talk about REALD and SOGI together. We're creating a SOGI web page where we can post our draft SOGI recommendations and keep people informed about our progress with SOGI. We'll also be creating a page for House Bill 3159 updates where people can sign up to get updates on a listserv. So the web page for our REALD website, please bookmark that for now, and then in about a month, I'll go back to that and look for those other pages that I just mentioned. There's a lot going on right now, so we're trying to catch up very quickly.
Yes, there definitely is. And so I think that as we're able to, and that new information emerges, we can certainly consider future educational webinars if this has been helpful for people, and also share updates to the groups who attended. And I do have another chat question that came through in our next, so we have a couple more minutes so we can still answer this and maybe another question or two. The question reads, what guidance should we provide to folks that decline to state in how their application would be treated? And this question is from Deepti. And Deepti, I don't know, perhaps you may want to unmute and explain a little bit more about what you're hoping.
Yeah, hi.
Your question is.
Hi, this is Deepti. I was wondering, so if a person is not comfortable filling out the questions and they put decline to state for a lot of the answers, is there any guidance on how committee staff should treat that application in terms of how should we weigh those answers?
Yeah, please come back to us, the REALD, and so we tell all of the programs to work with us on thinking about what do you do with this data? So now you have this data, what do you do with it? And how do you interpret it? How do you work with it? And that's where we come in also. So we can work with the analysts and looking at that. Understand, if you have a lot of people who are declining, that's really good information. So if something happened in that process, maybe what was the process? Were they just given a paper form? We found in one place that there were many declines, and what happened is they were verbally asked, would you be willing to do REALD? And people would say no, and so they might decline. And that was what happened. It's like, no, you need to ask every question. So if you see, that's what we work with analysts. We look at patterns, see what's going on with the data, and then interrogate and dig that deeper to see what happened. Is there something that happened in that process, in that workflow or application process?
Thank you, Marjorie, and thanks for you and your team for being available to help when those certain situations arise where we do need that analytical expertise to understand how we go about using data when someone does repeatedly select decline to answer. So thank you for answering that. And thank you so much, Marjorie, for being available today to share information on REALD and SOGI and for answering our questions. I see another question just popped in as I'm wrapping things up. Let's see if we can go ahead and honor the question and see if we can answer here. So the question that just came in, building on the prior question, if the application was to be part of a committee, how will refusing to answer be treated? And so
that question, just
go ahead.
This is Leanne Johnson again, Director of Equity Inclusion for the Oregon Health Authority. And once again, based upon federal and state protections, we cannot we will not reject an application if someone has not done the REALD answers. We cannot base our decisions on that. It's more of an enhancement to help us move towards greater diversification, but it's not a process that can be used to rule out people, if that makes sense.
I think it makes absolute sense. It's very clear. Thank you, Leanne, and thank you for being our guest presenter. Thank you for pitching in. It certainly is great to see so many people attend today and ask questions, help answer questions. This is a collective effort that we're moving forward with as an agency. So we'll look to provide additional information and educational webinars as this work continues. Certainly, if you have additional thoughts, comments, questions, feel free to email Marjorie and myself. And we look forward to working with you and providing more information as that becomes available. Have a great day. I hope the sun's out where you are. It's out where I am. I'm going to go out and get some fresh air. So everyone take care of yourselves and each other. And good luck in your work with REALD and SOGI. Take care.
Thank you, everyone. Bye-bye.